often do you have a teenage patient?
I see teenage patients that are pregnant almost every week.
How young is the youngest patient you have ever had?
That was pregnant?
Yes.
12 years old.
So what are some of the differences between or a teenage pregnant person versus someone who is like a grown woman who's pregnant?
The pregnancy itself tends not to be very complicated in a teenage pregnancy. The hard part is the emotional aspect of trying to be in school, to realize that they have a pregnancy, to try and figure out that they need to be healthy for themselves and the baby, and then usually the pregnant teen not having an idea of how much stress there's going to be on their life after they have the baby.
So when do you think an abortion are available and necessary to a patient? And when do you think there's a line where they shouldn't be able to have an abortion?
I think that is more of a question, not necessarily for a doctor, but for a patient to decide, and it's for our society to decide. Are abortions necessary? Abortions are going to happen whether they're necessary or not. I think we need to make sure that they're safe so that people are not dying from abortions like they used to have happened. I think we should encourage ways of keeping people pregnant so they don't use abortion as a birth control. I think that's a much bigger problem, that there are people that use abortion as birth control. And it's not a good form of birth control, and it's emotionally very draining on the patient to have to deal with that. So there are times, I'm sure, in situations of rape or incest, that abortion should definitely be available. And there are also times that patients may choose to have an abortion. Whether I perform them or somebody else perform them is not the issue, but I think there needs to be an outlet for those patients.
So, what are some of the main reasons that patients have, or teenage patients have, for why they're pregnant?
I think one of the main reasons is not using effective contraception, i.e. birth control. There's lots of different types of birth control that can be used for teen patients, and they need to use them consistently and effectively for them to work. And that's a problem because 12, 13, 14-year-olds don't necessarily do anything consistently and effectively. I think once you start to have the other issue is every form of birth control can have a failure. I've seen pregnancies with every form of birth control, including having tubes tied and vasectomies. So if somebody is going to start having intercourse, there's a chance they could get pregnant, period. No matter how many condoms, no matter how many birth control pills you use. I think you need to be aware of that, do as much as you can to try and prevent it with birth control, but know that if you're not ready to be a parent, then you should think twice about having sex.
So, what would you say would be the best type of birth control, even though it doesn't always work?
Some of the most effective forms of birth control for teenagers are longer acting forms that they don't have to remember to take every day. There are birth control shots that can be given once every 3 months. There's an implant a tiny little implant that goes underneath the arm that could be used for a couple of years. There's also devices called intrauterine devices, or IUDs, that are good for anywhere from 5 to 10 years. And those are all extremely effective forms of birth control. Again, not 100%, but very effective, and not have to remember to take it. Certainly the only way to protect yourself from STDs, including things like HIV, which causes gonorrhea and chlamydia, among others, is to use condoms.
So, in a teenage pregnancy, how often, not that the father comes to the appointments with the doctor, but how often is the father there to support the mother and hasn't left?
I think it's harder for teenage fathers to leave just because teenagers are not moving anywhere. However, those fathers of the teenage pregnancy usually aren't involved, and their ability to be involved and be a parent is in question. 14-year-old boys are no more ready to be parents than 14-year-old girls.